Good evening. A decade of health disruption. This is the warning from the independent IPPR think tank. The disruption wrought by the COVID pandemic. Years of NHS progress at risk of being undone, they say, leaving the health service overwhelmed. Tonight, the cost of COVID to a service so central to maintaining the nation's health. And the government still not saying what it's prepared to spend next year. Millions of GP appointments missed, record waiting lists for mental health treatment, and cancer deaths predicted to rise. The true price of the pandemic, according to a new report by a leading think tank given exclusively to Channel 4 News. The IPPR says NHS England will need £12 billion a year extra for both health and social care if there is any hope of a post-COVID recovery. Our health and social care editor Victoria MacDonald has this report.
Measuring the toll COVID has taken on the NHS is often portrayed in numbers, but this is the face of the pandemic's impact. 28-year-old Bobby Bertoli, whose cancer diagnosis was delayed.
The colonoscopy was supposed to happen in February 2020, but that was delayed 2 or 3 times, and I ended up having to go into A&E twice in May and June because my symptoms were getting just that bit worse.
He had stage 4 bowel cancer and has been through a grueling year and is only now coming out the other side.
Our wards kept being moved, so UCH is a tower, and we essentially were moved up and up the tower as more COVID wards needed to be made available. And we ended up in the child's ward. It was just the NHS working incredibly hard to make sure that crucial cancer care continued.
Bowel Cancer UK estimates the number of people in England waiting longer than 6 weeks for tests that can diagnose bowel cancer has increased 6-fold in the past year. And that is just one disease amongst many others that have been impacted because of the strain the NHS has been under. Today, there are calls for a massive shot in the arm for the NHS and social care to undo some of this damage.
There are only a couple of weeks left until the end of the financial year, and yet still no mention of a settlement for the health service or social care. There was barely a mention in the budget last week, and then the following day they sneaked out the offer of a 1% pay rise for NHS staff. Yet the government is being warned loud and clear that there is a massive backlog of treatments, that the waiting lists are at record highs, and that they need to spend more money to deal not just with those, but also with the ongoing costs of the pandemic.
And today, the influential think tank, the IPPR, put the booster shot they think England's health and care service needs at an extra £12 billion a year.
A lot of it goes on social care, reform and funding, making social care free at the point of need, just like the NHS. A large amount goes on the workforce, NHS workers and social care workers. There's a strong misalignment between the contribution these workers make to our society and the reward they get for that. And better pay really is at the heart of retaining that workforce. And then lastly, we put together a pandemic funding settlement. That's to address the elective care backlog that's built up during the pandemic and the rise in mental health care.
The figures are stark. In the past year, there have been 31 million fewer GP appointments. There will be, they say, 4,500 avoidable cancer deaths. 235,000 fewer people were referred for psychological therapies. And there will be 12,000 avoidable heart attacks and strokes in the next 5 years. Last week, Sir Simon Stevens, head of NHS England, put the figure at an extra £8 billion for England's health service, over and above any settlement to cover the pandemic expenses. Today, the NHS Confederation warned of the need for budgetary certainty if there was any hope of recovering services while still dealing with the pandemic.
Force right across the NHS who've done an incredible job.
Today, the Health Secretary wouldn't be drawn on any extra funding, perhaps a sign he has not yet won any battle with the Treasury.
Working out the exact operational costs is we will be publishing shortly, but what all parts of the NHS know, and we've made very clear to them, is that the direct operational costs of COVID will be covered, and so people can plan with confidence.
Which puts eyes on the Chancellor, Rishi Sunak, and how the Treasury defines COVID spending. But the warning in today's IPPR report is simply that without extra funding, years of progress will be undone.
Victoria MacDonald. Now joining us is the Chief Executive of the NHS Confederation, Danny Mortimer. Mr. Mortimer, you have written to the Chancellor warning him that a failure to confirm the NHS budget this week will have an impact on services and communities around the country. Why have you given him quite such a stark warning?
Well, John, it's a quite exceptional position to be in for the country's biggest public service to still not have an agreed budget and its new financial year starting in 2 weeks' time. These are budgets that are used in every community in the country to provide services to patients, both through hospitals and in community services, and we need certainty for these services. The point made in your report is that we need investment for the longer term as well, but we absolutely need certainty for a financial year that starts in a fortnight's time.
That report from the IPPR think tank, do you basically agree with all of it?
I think the broad thrust of what they've described, absolutely, leaders in the NHS would agree with that. I think the messages around the need for a long-term plan and long-term investment in social care after decades of neglect of that area, we would particularly endorse. But we absolutely recognise, and our members recognise, that we've seen significant drops in activity. We've not seen patients being referred into hospitals, for example, in anywhere near the numbers that we would do normally, a 30% fall there. We anticipate a significant surge in mental health demand, and I think we're still only beginning to understand the long-term impact of COVID on people's health, the so-called long COVID set of conditions that are affecting people's health for months, and we suspect many years to come as well.
But there's an equally frightening backdrop to all this. I mean, something has to give, doesn't it? The country has an enormous debt, £350 billion. The NHS budget is, what, £200 billion? We just can't afford this.
And the position we're in, and of course the NHS understands, and we do understand the government needs to make choices and needs to set priorities. But if the government chooses not to follow the broad thrust of the IPPR's message, the broad thrust of the feedback we're giving them, then the government has to have an honest conversation with the public about what it is the NHS can achieve and how long it will take the NHS to recover the kind of waiting times, to clear the kind of backlog that Mr. Bartoli described and others can describe as well. And that's what we're not hearing from the government. We saw a budget a fortnight ago that did not mention health or social care at all. And what we haven't had is the government explaining clearly what that means for us for this next year and longer.
So briefly, what can you say to reassure patients who may be waiting for their hospital appointments? What can they expect?
Well, I think there's a couple of things. I think the first thing, as you saw from Victoria's piece with Mr. Bartoli, we've done everything we can to maintain treatments, particularly for the most urgent patients during the pandemic. I think the second thing is that we will begin a process now of prioritising treatment for people. And absolutely, NHS staff will continue to do their absolute best, their level best, to provide treatment to people. But we do need support from the government. The investment that's been described would make a massive difference. Investment in workforce for the longer term would also make a massive difference. And as I said, finally addressing the problems and challenges that are facing the social care sector in this country would make a tremendous difference, both to the health service, but also the country as a whole.
Danny Mortimer, thank you very much indeed for joining us.